Hello, I'm Mark Rickenbach. I'm a GP and also Professor of Healthcare at Winchester University and Primary Care Lead for Education in Wessex CRN. And I'm just going to talk to you about some of the initiatives in primary care that are going on at the moment. This was presented at the BJGP Research Conference, but this is a sort of edited version for our CRN. And it was co-presented with Martine Cross, who's our research delivery manager. And the team who have been involved with primary care education on research in Wessex CRN includes Johnny Leon Maris, who's the Professor of Education at the GP Education Unit or Vocational Training at Southampton. Patrick Moore, who's our Associate Director for CRN Wessex and GP, and Nick Francis, who's our Primary Care Professor of Research at the Primary Care Research Centre at the University of Southampton. And Wessex CRN is shortly to become the South East Regional Research Delivery Network, as you can see. The first message is that research has been written into many of the important contracts and documents, in particular the GMC Generic Professional Capabilities Framework. And it talks about normalizing research and research being part of day-to-day clinical practice. There are 9 domains for this capabilities framework, and the 9th is devoted to research. And the things it talks about is conducting literature searches, knowledge of research methods, including qualitative and quantitative approaches, recruitment into trials, interpreting clinical evidence. And it talks about it being proportionate to the role or appropriate to the role, but the message is it's there. It's also in the RCGP curriculum. It's in the primary care network guidances, and it is part of the Integrated Care Board, Integrated Care System requirements. And when we're talking to individuals, we've got to think about what research does. It helps individual patients, those who go through a research trial, do better. It helps the local population and general population and global knowledge. Also, in a practice, it increases interest in the work. There's a potential possibility to increase GP retention and staff retention because of that interest. And it is a stream of clinical care funding coming through the research side. In primary care research, it should be the centre for research across a CRN, because we've got all the patients and almost all the patients and all the health conditions. And we have a long-term relationship that facilitates recruitment, and we've got comprehensive healthcare records. But over the last few years, we've had falling research activity. The support structure is secondary care type, and therefore is not quite as appropriate for primary care. And there's less support anyway for primary care than secondary care. And also, there's less clinical research career support in primary care than for academic careers. There's even a lack of support for academic careers in primary care compared to the secondary care setting. So this specialty should have the highest research activity if we can get the initiatives right. So our aims here are to incentivize and increase primary care research activity and to apply and share those innovative approaches we're doing. And there's 4 approaches that I talk about today. One is the national accreditation of research as part of GP vocational training, a flexible career scheme for the clinical career GP, practice, community and network orientated research support, and getting research design appropriate to the setting. So first of all, Johnny Leon Maris at the GP Education Unit in Southampton approached the Royal College of GP and lobbied for research to count towards vocational training. So now, if you do some research in the time of your vocational training, it will count towards your certificate of completion of training. And that's an important step forward. It means that we can design integrated training posts alongside clinical placements, usually in primary care itself. And those posts, we're looking at two sessions with one session of supervision and research education. And those two sessions are meant to be focused on doing research. They are spread over about 15 to 18 months, depending on the design of the post. And therefore they sit alongside clinical work in ST2, moving into ST3. And we are hoping for HEE funding, but it may be appropriate to be funded from other sources, including the CRN. That starts vocational training. Nick Francis has been developing participatory posts where you can participate in research for 5 sessions over a period of time, and that gives you a taste. You're working alongside an active academic researcher and learning what they're doing and being involved in a project. And we are now looking at clinical research posts. We've actually appointed 4 people starting in April 2023. And these posts are aimed to be tailored to the clinical researcher. So they're sort of sitting around them in their own practice. And their aim is to increase research activity. And this is important because that will then generate future income for longer term placements for these individuals if they wish to carry on in the arrangement they've set up. Again, a minimum of 2 consecutive sessions at one centre to get them involved in that centre and research active. And there's a range of centres. The research hubs have been set up in CRN Wessex, and they're primarily looking at vaccines. And then we're moving on to other types of research. And so we're looking at these GP fellows in their clinical research posts being attached to them. We also expect them to be working in their own GP practice, and it may be a research practice, but if not, they'll be attached to the research practice nearby. And they'll also be attached to the academic centre nearby, usually Southampton University or Bournemouth University. Up to 5 sessions, but most people have chosen 3 sessions. And at the end, on a day-to-day basis, we'd expect to report on research activity and learning, which then accumulates, shows what activity is taking place, along with other measures. And we'd expect a review of goals with those academic research or research hub supervisors on regular basis, usually every 3 months. Then we move on to network support. There's the Research Support Initiative, which I hope people are familiar with. Level 1, 2 research projects, level 2, 5 research projects, and level or sessional, which might be equivalent to a level 3, where you're doing 7 research projects and involving other practices locally. They each have a different level of funding, and it has worked well as a sort of step ladder to get people involved in research. We're looking at setting up an initial almost level 0.5 introductory process whereby people get involved with studies like Principal or Panoramic, I'll talk about in a minute, where they're just signposting towards the studies as PIC sites. And we're hoping that we can get measurement in place for PIC sites. And indeed, Philip Evans, who runs the national primary care side for NHR, was talking about the fact that PIC sites are now being recognised so we can count activity in primary care. So what new schemes have we got? Well, any network that's in place can be funded sufficiently to cover the central hub of a research practice and spoke practices, so they're pulling in new practices. Or it might be a research network that already exists that we can see between practices, but we're focusing at them currently on primary care networks because they are the current model of working between practices. We're also working with integrated care systems to try and push them towards doing more research. And we are encouraging them to use the CCG funding for a certain level of research activity, which can now be utilised by the integrated care systems to encourage research further. And the picture here is to demonstrate that there's many other community sort of placements that could be taking place, and other community teams that are working with primary care in research. Research has changed and become more focused on the day-to-day practice thanks to COVID. Panoramic and Principal are both examples of research where any practice can be involved, any practice, any community centre can refer people into the studies, in this case looking at COVID for existing and novel treatments. And this means that we can have much more activity in all centres in the primary care setting, in community setting. Studies are more focused on the setting itself, amitriptyline for the prevention of post-herpetic neuralgia and for irritable bowel syndrome symptoms, is an example of a study which is focused towards primary care, because this is a treatment that is used already, and the team work alongside the recruiting practice. We think these are transferable approaches, and that research can be increased across the UK. And the key points, therefore, are that research placements can be accredited towards GP vocational training. This is new, so you could contact your academic centre or GP education teams to set this up elsewhere. That clinician researcher posts are needed to provide long-term clinically based GPs for research interest, and to be flexible and designed around the GP. That there are network models of support and incentives that could be reviewed, and primary care networks in particular to be looked at. And early involvement in research design would encourage clinical signposting towards those research projects. So we have a network of GP locality leads who could be involved earlier in the design of research to make it more appropriate to the setting of primary care. So thank you very much for that. And if you have any questions, do contact me, Mark Rickenbach. That's mark.rickenbach@nhs.net, or via the Wessex CRN. Thank you very much.